I'm Gia and usually tell jokes on YouTube. But today I'm going to the vet because my knee hurts and the Auto Queen and Galopant isn't fixing it. Continue watching and the vet will explain what happens next.
Hey, I'm Dr. Robert Venon.
I want to get a better view. There we go.
Hey, I'm Dr. Robert Venon. I'm going to be helping out Gia. Gia's been limping for a month to two on the back right leg. You said 4?
4.
4 months?
It's been a long
on
time.
and off? Oh,
yeah, it's been a long time.
And okay, we're going to see what we can do. We're going to see how we can help, okay? So, and she started limping recently on a front leg, you said?
Yeah, the last couple of days, that right front leg.
You can see, and something that's a clue to that is whenever they're standing, if their elbow starts to point outward, it means that they have weakness. And a lot of times, whenever
So
they're
let's see, is her elbow
compensating,
this
this
way?
guy right here, and you see how it turns out a little bit. And a lot of times when they're compensating on this right side for a hurt leg, they're shifting weight up and away from that leg. And so the other legs can have a little bit more strain on them. And sometimes that's all that's a result of, is just being exhausted after compensating for a hurt leg for a long time. But other times it can be an injury in and of itself. So let's see. Hi, my
I was
love.
thinking that she's just been, having to put more stress on the other
Yeah.
3.
And then look, there's times she just has the zoomies in the yard, and
Yeah.
I'm trying to keep her from running in the yard. We do walk her every day on a leash,
Yeah.
but that way I can control it.
Yeah, that's good. Low impact exercise is the best thing for joints, but they're.
But if she hears a meow or a squeak, her sister's serious. The Todd's Pit Mix Ripley is her sister, but that one runs. There was a cat meowing on TV, and she runs outside looking.
we gotta find him. Hi, baby. I know it's gonna be okay.
So you're just checking the joints right here?
Yeah, we're checking long bones and joints, making sure that we're not seeing any pain. Now, she was more uncomfortable with flexing this elbow than the left elbow, so let's see if it's repeatable. See, like whenever I flexed it up, she starts shifting around. So she could have some arthritis in this elbow, and it could be just related to extra forces being put on it. We could get an x-ray of that. The fact that it's worsening while we're treating arthritis is a little bit of a concern. Yeah, I know, my baby. But I would get a picture of it while we're trying to figure out all the things that are causing pain on her. I would add that to the list. Hi, my love. You're gonna be okay.
Gotcha.
I know. Don't worry. Oh, I know. Her appetite's been good through all
Yeah.
this. Good.
I've actually, because I've had joint issues, and when I've done research on my own joints, one of the things I found helpful was flaxseed oil, like not the cold pressed flax seeds, but
So-
the oil itself.
So a fun fact is that humans can gather the omega fatty acids from flax seeds, and dogs can't.
Oh,
Yeah, so in humans it actually is a good source for omegas, but in dogs it's not useful. So
Okay.
it's okay.
I mean,
It's
she
not
likes the
harmful.
taste of it.
Yeah, it's not harmful, but the dogs, the cold weather fish are going to be your best sources for your omegas.
Well, she's on a salmon diet.
Yeah.
Like-
So a clue that I have right now that I'm feeling is in a normal knee, you can grab the patellar ligament where the kneecap inserts to the shin bone, and you can grab it and feel it pretty good. And whenever we have fluid, we can't grab it. So what happens is you have that line, and the fluid actually pooches out on the side so that it's pushing your fingers away from it to be able to grab it. And I can feel that we have some fluid in this knee compared to the other one where I can actually get my fingers
And that's
in there.
that's the healthy knee, and this one.
This is the healthy knee that I can grab the patellar ligament, and this is the hurt knee that I can't grab the patellar ligament. My fingers are just sliding right around.
and she's just so calm right now.
Yeah, we're not doing anything super painful. Whenever I go to grab it, she's like, okay, yes, that's where I hurt. But her kneecap is in place. It's not luxated out. A lot of times the kneecap can slide inward, which can be a result of or a cause of an ACL tear. But our most common injury we have in our hind limb is an ACL tear. The ACL is responsible for making sure
Is that the same as the CCL?
yes, it's technically CCL in dogs. It's ACL in humans. So that structure is responsible for making sure that the shin bone can't slide cranially or forward in relation to the thigh bone. And so our test is to actually grab these bones and put force forward. And a lot of times they're uncomfortable with it.
She's not whining or anything,
Yeah.
but she's
She ain't
maneuvering.
having
Yeah. A lot of times we need to give them a little bit of pain control to be able to test it and to get the x-rays so that we can really get a good diagnosis. I'm in love. I know.
Are you going to keep her on the Galliprant?
Galliprant is actually a very good choice. So as an anti-inflammatory, it's just like you or I take an Advil. It's good for joint pain for sure. The Galliprant it works differently than our other classic anti-inflammatories. So there are less side effects with like your this is an ACL tear, with your kidneys and your liver. So it works past the step that causes the complication. So it's safer for our older patients for long-term administration, and it is something that I would not come off of. I would go ahead and use
Okay.
that one.
Yeah, I ordered some from Chewy.
Yeah.
The vet at Expressway, they charged me $12
It's expensive
to get the prescription
Still,
changed.
yeah.
And for them, they
to
they
get it
charge.
changed to Chewy.
Yeah, because Chewy charges $4 a pill, and they charge.
It's actually it's not legal to charge to write a prescription. Not legal to charge to write a prescription. I don't know what the situation was. If it was like a refund, like they charged you for like refunding or whatnot. But
No, they told me that they wouldn't give me the prescription they wouldn't let Chewy have the prescription unless I paid them a $12 prescription fee.
that's not.
Or it was $10, but because I had to do it over the phone on Friday, and I was like,
It's not legal to charge to write a prescription.
I didn't know that.
Yeah, it's not legal. Sorry,
I mean-
I don't know the situation.
I guess
There's got to be something else
they-
that was going on.
Well,
but
they could fill the prescription, but
Yeah.
their price was $2 a pill higher, and if it was
Yeah.
only a few minutes, it's not worth it for me
Mhm.
to worry about it. But if she's going to be on it long term,
Yeah, no, and that's the thing. Being on it is the important part. So where you get it from isn't important.
well, right now I'm waiting
so
on
where do we go
some.
from here?
Yeah. So what I need to do, we need to give her an injection for pain and just to kind of calm her down a little bit. We need to get X-rays of this guy. I would go ahead and get X-rays of the elbow while we're going under. I'm sure this is just going to be arthritic changes. It's not going to be anything crazy in the elbow. And I think that the knee is actually the reason that we're starting to see signs from it is because we have some arthritis on that elbow and we're putting more weight on it. So I think that we could talk about joint supplements extra on top of the Adequin. I love Adequin, but we can add on like the eggshell membrane, the green lip muscle extract. There's a lot of different options, the collagen supplements. So we could talk about all those things. I would do more than just the Adequin because we're starting to see these signs while being on the Adequin. So I would do a little bit more. Fish oils are great too. So like the flaxseed for humans, but we would do one that would be good for dogs.
What do you recommend for dog? You said the green. You have a
There's green lip muscle extract, there's eggshell membrane and collagen supplements that there's been a lot of recent research on those three, and then there's some that kind of try to combine. There's Boswellia extract in the Dosiquin Advanced that has the eggshell membrane, so I do like that one. But if we're already on the Adequin, that's really what that Dosiquin is for, is that glucosamine chondroitin sulfate. So, but you can do that and then add in piece by piece the other stuff. So Movoflex has the eggshell membrane, Osteo True Benefits has the green lip muscle extract, and then there's a UC2 collagen supplement. Those are three that I really like whenever we're struggling. I normally add them on piece by piece. Other than that, as far as the discomfort long term, there is a nerve growth factor inhibitor injection called Librela. That's a newer medication that's been doing a lot of great things for dogs with arthritic pain. I would hold off on it, especially if we're talking about surgery, because we don't want to do that associated with surgery.
What are the chances? Is there a chance that we could fix this without surgery?
Not likely. So if this is an ACL tear, no. If it's been persistent, we've already tried our NSAIDs and our joint supplements. This is what you're going to basically get. The surgery is aimed at preventing long-term arthritis developing. So while you can ignore it, in essence, and let arthritis take over, it'll ankylose the knee. The knee will be super painful. and it'll be functional to a point until they tear the other side. And then they will rely on a very painful leg because that will be their better option. I forget the statistic, but there's a high percentage of dogs that within a year of tearing one side of the ACL, they will tear the other. Because of the same issue that led to the first one. Now we're putting more force on the second one. Yes. The actual issue in dogs is a degenerative change. I'm gonna draw this for you. So this is.
I'm gonna get one of your models.
Yeah, that'd be a good idea. So this is going to be our shin bone here, okay? This is what we call our tibial plateau. Imagine the femur as a ball, okay? And whenever we put downward force, it wants to slide down the hill, okay? And so both shins were formed the same way, and that slope is going to be the same on both sides. And what keeps the ball from rolling down is the cranial cruciate ligament. And so I always tell people, imagine like a tether on a mountain, right? If that mountain is really steep, there's a lot of force on that tether.
It's actually like a leash.
Yeah, exactly. It's a leash that's holding that ball from sliding down.
Holding that bad bone from not going down.
Yeah, and if that tears, this is going to slide, and the sliding causes damage to the meniscus. It causes inflammation, it causes pain, and everyone knows that ACL tears are painful. That's not a mystery. What we do is we try to eliminate the need for this ACL by basically leveling off this plateau. So whenever the forces go down, we don't have a forward or backward shift or strain. Look, this is my guy. My MPL guy. Okay,
Yeah,
so this guy's my ACL. It's supposed to keep the shin bone from being able to slide forward. It's torn in this guy, and what we
Hold
do.
on, let me see if I got a good.
So this is the cranial cruciate ligament here.
That's the cranial, and
it belongs back there, and it prevents this motion here.
Okay.
All right. And so what we do is whenever we step, there's downward force, and whenever that slope is like that downward force slides down the hill. Okay. Whenever we look here, this is our meniscus right here, and that's what gets torn a lot of times whenever we're grinding on the tibial plateau. And so our goal is to stabilize all that, minimize arthritis, and long-term pain. So that's why surgery is the number one.
Surgery? I don't want surgery. But watch the next video to hear why the vet doesn't think I should wear a brace.